Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to show you a before and after of an actual Invisalign patient treated at our office. We'll show you everything from start to finish as far as our treatment plan, why we decided to do the things we did, and hopefully answer some questions about how Invisalign works and show you how the whole process goes. So let's get started. Alright, so we're going to jump in here and I'm going to walk you through this patient's photos as well as her Invisalign ClinCheck. So this is how this patient started. So this patient was actually a grandmother of two of our patients. She had brought her grandkids in for their braces adjustment, and while she was there she just asked out of curiosity, is Invisalign something that might work for me? I had braces when I was really young as a teenager, and a few things have shifted. I really hate the way that my teeth look. I feel like my front teeth stick out too far. I don't like smiling in photos. Is there a way that maybe Invisalign might work, as she didn't really want to get braces as a grandmother when her grandkids were in braces? So we took a look at her teeth, and as you can see, the front teeth are kind of protrusive. Also, if you can see, these back molars, her second molars, are in full what's called a buccal crossbite. If you've seen some of our other videos, we explain what a buccal crossbite is, but basically the entire upper tooth is outside of the bottom tooth. So I spoke with her and asked if that was something that her original orthodontist had addressed, and she said that it was there, but they didn't really worry too much about it. So it's something that I said, while we're fixing the overbite and those proclined front teeth, let's go ahead and get that fixed as well. So she decided to move forward with Invisalign. So anytime that we're working with an adult, we have a little bit fewer options for overbite correction. So in her case, we didn't expect a lot of movement from either elastics or rubber bands with her Invisalign. So instead, to help bring her front teeth back, what we did is we actually made some small spaces between her front teeth on top so that we had some gaps that we can pull those teeth back. So we made just small little spaces between all of the front, about 6 or 8 teeth. We made about like a 0.5 millimeter to 1 millimeter gap all the way around. And using that extra space, that's what we were going to use to start pulling those front teeth back. So we'll jump in here and show you what's called the Invisalign ClinCheck. This is what we get back from Invisalign. This will actually show you a little bit different angle what her teeth look like. So as you can see, here is the buccal crossbite. That top molar was entirely outside of the bottom molar. You can see how proclined those front teeth are. And then also she has, as you can see here, this is where we made the spaces. You can actually see it in the ClinCheck here. You can see we made little gaps between all of these top teeth. And then with Invisalign, we're going to start bringing these teeth back to help with the bite correction. So now we'll show you what we had planned as part of her treatment. So you can see each one of these is a stage where the teeth are going to be brought back. As you can see here in red is what's called the Invisalign Attachments. Those are little attachments that we glue on the teeth that acts as a handle so the Invisalign tray has something to grab and pull the teeth with. And then gradually those front teeth are brought back. We also had her wear some rubber bands to help with the bite correction. And then I'll show you a view from the back on how we fixed that buccal crossbite. So you can see with the Invisalign, we were able to get those teeth to cross back over. And so that was our initial plan. And so she had about 19 trays, which was about 19 weeks of treatment. As you can see, it looks really good. These are the Invisalign attachments on her teeth still. This is the buttons that we use for rubber bands to help with the bite correction. As you can see, we got about 90–95% of the way there. That's pretty normal with the first set of trays with Invisalign. So the first set gets a lot of the correction done, but most of the time there still are a few things that can be fixed. So as you can see, her lower front teeth, they aren't perfectly straight quite yet. They're a little bit crowded. Also, she had a little bit of space left on the top. And then this tooth here, we felt like we could get that down a little bit better. So we went ahead and got her a second set of trays. That's pretty standard with Invisalign. And then you can see this is how she finished after that second set of trays. And you can see closely on those back molars, we got full correction of that buccal crossbite. We were able to bring those front teeth back, really give her a great smile, no more front teeth sticking out. And then all the teeth got well aligned as well. We'll jump into a before and after. You can see how dramatic the change was on those back molars. That was something that we were more concerned with than she was. But also you can see how much of that overbite we were able to reduce. You can see she had probably 6 millimeters of overbite there. We brought it back to what we would consider ideal. All the front teeth got straight. And then you can see from the smile how big a difference that made, where before when she smiled, she felt like the teeth were sticking out of her mouth. Now she had a nice, beautiful smile that she wasn't ashamed of, and she had a much more confidence now when she was smiling in photos. So that is it. This whole treatment took about 14 months from start to finish, and we felt like we got a great result with this one. This is a great option for people who have kind of like a mild to moderate overbite, and it gives a great result without too much treatment. It's a pretty easy process. So if you have any questions about overbite correction with Invisalign, feel free to ask them in the comment section below. If you have any questions about Invisalign in general, feel free to ask. We'll do our best to answer those. And if you found this video helpful, please give this video a like. Also subscribe to our channel for more braces and Invisalign related content. And make sure to tap that bell. Thank you so much for watching. We'll talk to you soon.